Hello and welcome to our presentation. We are a team from the University of Iowa Biomedical Engineering Department, and today I'm going to be talking about our project, Assisting the Transition to Complete Dentures. There are 36 million Americans with edentulous jaws, of which 32.4 million have obtained dentures at some point. As seen in the figures shown, the denture fabrication process can take 6 weeks to form a suitable device, which is a fairly lengthy period, and during this time many factors can be introduced that render the dentures ill-fitting. And while waiting for their dentures, the patient loses a significant amount of muscle mass required for motions such as eating and talking. And as you can see in the figure, as a patient loses teeth, the jaw height of a patient can change up to 20 millimeters, and this can induce masticatory inefficiency resulting from loss of masseter and surrounding muscle mass. Additionally, when a patient receives their dentures, they can experience stress on their gums, resulting in tissue blanching from the negation of blood flow, as shown in the image on the right. If not identified immediately, these areas of impingement can turn into ulcers, as shown on the left. Needed refinements on the denture are often indicated using pressure indicating paste, or also known as PIP, but despite its wide use, PIP is a non-numerical analysis that frequently identifies false positives such as swelling from denture adaptation. If too much of the denture is removed to reduce impingement, it will often be too loose following the denture adaptation. Loose dentures can induce difficulty in talking and eating due to poor retention, potentially causing long-term oral health consequences such as ulcers, jaw atrophy, and tumor formation. Overall, loose-fitting dentures can be a perpetual problem to the patient's difficulty to adapt to the prosthetic. Here we have our proposed patient timeline. The main goal of the device is simply to help transition the user into their final denture. The current fabrication timeline of the final denture is about 6 weeks, and during this time the patient most often has all of their teeth extracted and is only waiting for their final prosthesis to be fabricated. Rather than attempting to enhance our pressure indicating abilities alongside the use of PIP, it was determined to be most optimal to take advantage of this 6-week period in which the patient is without teeth or dentures and try to prevent impingement and blanching from even forming in the first place. Our current design is made of ethylene vinyl acetate, or EVA, which is a sound material that can resist fracture and fatigue from cyclic wear. It has a low hardness, making it an ideal transition material prior to the final solid acrylic denture, and the polymers in EVA can deform with swelling to provide comfort and return to the natural position as swelling decreases. The EVA will be vacuum sealed around the patient's initial impression made at the first appointment to create a patient-unique device to adhere comfortably to the patient's gum tissue. The patient will imitate the current denture adjustment process, and they will wear this device overnight prior to their second appointment, where it will be adjusted to the patient's mouth, and then it will be worn as much as possible each day until the final denture is received. In order to find out that the maximum stress threshold for pain on gums, which is 27.5 newtons per square centimeter, has not been exceeded, these thin strain sensors will be used to get quantitative numbers. This device is currently planned to be with the patient for a month and will need to be cleaned regularly. And whether the device harbors harmful fungi or bacteria more than accepted soft liners is unknown and will need to be determined. Testing of various cleaning methods will reveal the most optimal for the patient, and our options we're choosing from include baking soda or toothpaste and manual scrubbing, antiseptic soak, vinegar, hydrogen peroxide, soap and water, and many other store-bought mouthguard cleaners. Degradation time for EVA is around 5 years and is an important characteristic that will need to be considered despite being used for approximately a month. The prototype along with accepted soft liner materials will be placed into our human mouth analog, as we're using a jaw articulator, and cycled several hundred times so as to simulate a few days of chewing motion that the patient will carry out while wearing the device. Water resiliency will also need to be analyzed. In a healthy person with normal salivary function, around 1.5 liters of saliva is produced in a day. With 99.5% of saliva consisting of water, the device's reaction to this needs to be considered.